Pentec Health's nurses manage the patient care delivery of targeted drugs for over 5,000 chronic pain or spasticity patients with intrathecal pumps throughout the United States. There are approximately 140 nurses in 45 different states, which presents a challenge to implement something new in the clinical setting, which for us is in the patient's home. The use of technology is an absolute must to communicate and educate amongst each other. Everything from apps on our cell phones to telecommunication solutions are maximized for ultimate productivity. Creative juices were flowing over during the pathway journey. Nurses felt the need to find ways to provide patient comfort and could be self-initiated by the patient for relief at any time, thus increasing the patient's feeling of control. We were looking for something that was in the realm of nursing practice that could complement the medical model and be individualized for each patient. Leanne Lee proposed the addition of integrative care to our already best-in-class patient care so that nurses would feel more effective in what they do. The vision of each nurse having a bag of tricks or menu that the patient or nurse could use to choose techniques such as music therapy or motivational interviewing, individualized for each patient, stirred excitement throughout the nurse department. Leanne formed the ICE team and started seeking information, education, and expert advice. Her grant proposal, which was well written by the team, was chosen for the 2018 Pathway Award. Nurse coaching entered the picture and now complemented the vision of enhanced nursing care delivery with expert interventions. We used a two-pronged approach to the project to maximize its scope and to provide validity to our initiative. First, a research project was initiated, having consulted a research professor, measuring the effect of music video therapy during the refill procedure with a needle stick. We wanted to be sure that an integrative care technique would have solid data with positive results, thus evidence-based practice. Second, another expert in integrative care was consulted to share knowledge, prepare the ICE team, and plan education throughout the department. At a time when the opioid crisis is a concern of everyone's, Pentec Health nurses can collaborate with physicians to administer medication complemented with integrative care delivered by RNs. Functioning at the top of practice, RNs can individualize patients' plan of care while partnering with the healthcare team.
After we received the grant, we chose 3 nurse investigators to complete the research study, and then we decided that we were going to see patients who had refill intervals 60 days or less. The patient visits consisted of 3 visits. The first visit, we would just complete the refill. However, we would measure their pain, anxiety, and their blood pressure, their vital signs before that visit. The second and third visit, we would use the iPad and the earbuds to prevent any distraction from any outside factors. We would also measure their pain the same way with the first visit using the Defense and Veterans Pain Rating Scale, which is measurable and validated. We would also measure their anxiety before and after using the State Trait Inventory. The refill includes us preparing the patient, and this includes preparing a sterile field, and we have the patient get comfortable whether that's laying or sitting. We sterilize the area that we will be doing the refill, the stick on the patient's pump. We locate the abdomen or the sacral area where the pump is, and we stick the patient with a large needle, and then we remove the old medication from the pump and we replace it with the new medication. This procedure can last up to 20 minutes depending on the patient's anxiety level or pain level or distraction factors. One success story that comes to mind is one of my personal patients that suffers from daily anxiety and is extremely anxious during her refills due to negative past experiences in which her refill procedure was extremely painful. We now use the iPad and video with her refills after the research because she calms down and will sleep during the refill. Not only is this response positive for her, but it's also positive for me. I'm not anxious during her refill.
As the number of health coaches has increased throughout the country, The need for coaches with the extensive background in education and critical thinking skills of the registered nurse has emerged. Patients that are being referred to health coaches for lifestyle change and management of chronic diseases is increasing. Nurse coaches are equipped to help patients move toward wellness while also assessing and identifying symptoms and conditions that require medical assessment. Nurse coaching helps patients identify strengths and motivation within themselves and guide them to make changes toward health promotion and wellness. Research shows that the therapeutic presence and interaction between a nurse and patient can be a healing moment, providing comfort, support, and lowering the stress response. Pentec Health nurses have a unique opportunity to use coaching and communication techniques to help patients explore their health choices and behaviors. This will help the patient establish goals and strategies for healthier lifestyle behaviors. This can be accomplished by listening to a patient's story, by picking up on and exploring a patient's change talk, or by assisting the patient to create a goal or personal improvement plan. We know that we offer patients more than just a pump refill or adjustment. Adding coaching techniques to the care that we already provide, we can help empower patients and see them move toward wellness. The ICE team was introduced to nurse coaching and imagined that it would work very well with our patient population. We sought out an expert in holistic nursing and nurse coaching to train our team and lead our team pilot training. This pilot group also included a few nurses that were not part of our team to gauge how the topic and techniques may be absorbed by the Pentec nursing department as a whole. We also had Zoom calls to discuss and practice our new techniques. The group was divided into dyads to practice one-on-one coaching and to perfect these skills. We were pleased to find that not only did our committee members enjoy and implement these skills with patients, but the other non-team members of the pilot took to these techniques and utilized them with patients with great success. Using these skills and technological capabilities, Pentec Health nurses can help people with chronic illnesses find their own motivation to move toward behavioral change and health improvement. Our nurses also had a positive response to the training. Some nurses reported having a dramatic change in their opinions about integrative care and their own ability to implement these skills in their practice. There was also a strong need to encourage self-care in our nursing staff, knowing that we need to care for ourselves before we can adequately care for others. Making a difference in the lives of nurses and patients alike, we hope to reach many with the hope and strength of self-empowerment.
I was going to the doctor's office to have my pump refilled every 2 months. Sometimes it was every month. And he had a nurse come into the office from Pentec, and she started doing my refills in the office.
I could tell that she was just having a hard time getting there. We didn't have enough time to really get to know each other, really feel like I could meet her needs. When the opportunity came for her to be seen at the home, I encouraged her to take advantage of that. And so I would come to her house to refill her pump, and it has been so much easier for her. I felt like Jamie was very open to me managing her pump in her home setting. She had no problem welcoming me into her home. I felt like we had an opportunity to talk and to get to know each other, and I could feel like I could really help her more.
Integrative care has given me the tools to help me with the pain. I visualize actually an elevator, and I start breathing slowly, inhaling as the elevator goes up, and when I get to the top, I kind of hold my breath, and then as the elevator starts going down, I slowly exhale. It kind of will take the edge off because you are distracted. You're not focused on the pain. I'm not so hopeless now or depressed because the pain really takes a toll on you mentally.
On top of implementing integrative care, they are even more appreciative that we're just meeting more than just their physical needs. We are helping them cope, which is more than what an intrathecal pump can do. It helps, but we are doing more than that. We are helping them have a better quality of life. She's now getting out of the house. She's interacting more with her husband, her family, her friends. She's able to go to functions, whereas before she would just stay at home and feel depressed, and she's not that way anymore. It has been fulfilling for me to see how far Jamie has come and how she is able to cope with her pain. And it's fulfilling for me to see that I have helped her. I feel like I'm doing my job of what I wanted to be as a nurse. I feel like I'm meeting the whole physical and emotional needs of the patient, and that in itself is fulfilling for me.